Hi, my name is Hannah Richards, and this is my project titled Treatment Support for Substance Abuse. Just a quick abstract on my project. The purpose of this project is a policy review on group therapies offered in an adult detoxification unit inpatient. A little background: substance use treatment is thought to be most effective with optimal resources provided, inclusive of group therapies. This project was completed using the Appraisal for Guidelines for Research and Evaluation 2 instrument, also known as the AGREE-2 instrument. The AGREE-2 results of this project indicated that the current policy has significant areas in need of improvements or modifications. Continued research is indicated to continue to provide effective interventions in substance use, as well as a continuation of pushback and unwillingness for change in the healthcare system. So Chapter 1, Phenomenon of Interest. The PICO question for this project: in the group therapy programming policy within a detoxification facility for adults over the age of 18 with substance use disorders, does the policy provide guidance and efficient and effective clarification on therapies and attendance for this patient population in accordance with the AGREE-2 instruments domains? And then, if not, what modifications can be made? My interest in mental health began at a young age. I experienced, things from mental health that were personal as well as environmental with individuals that I know. I also sought out educational opportunities inclusive of psychology classes, sociology classes, throughout all of my educational history in college. And the substance use epidemic is hard not to notice and not hard not to care about in today's society. And I have worked for the last 3 years in the substance use treatment facility, which this project took place. Just a little bit about the problem. An individual with mental illness has increased mortality rates from a general medical condition, along with the risk of premature mortality as compared to an individual without a mental health illness, such as substance use. In 2019, over 70,000 deaths were due to drug overdoses alone in the United States, and deaths continue to rise on average by 4% each year since, according to the CDC. Substance use treatment facilities are crucial in fighting the ongoing detriment that is substance use disorders. Throughout the typical detox period in these facilities, the individual can choose to participate in therapy sessions and group activities to assist their mental, social, and emotional health. And then after the detox phase is complete, the individual is essentially symptom-free. They can be medically cleared to be either discharged or referred to a residential program, which will provide the individual with additional support to enhance their chances of remaining drug and or alcohol-free. Significance: patterns of knowing that inform nursing. Empirical knowledge is essential in the realm of substance abuse, specifically with effective therapeutic communication needed. Many individuals who suffer with mental health disorders, such as addiction, have difficult personalities and can be termed difficult to work with if the proper precautions and background of understanding are not met. So nursing knowledge plays a factor in the overall success of these patients and the success of their treatment team as a whole. Aesthetic knowing is the nurse's ability to sense a patient's need and then act on behalf by drawing on past experiences and knowledge. This nursing knowledge can assist in the patient population gaining trust and understanding that is sometimes difficult to obtain. Ethical knowledge is difficult to maneuver with this patient population. Individuals who struggle with substance abuse often do not have age-appropriate morals, or their morals and priorities have been altered through their life being overcome by addiction. Emancipatory knowing is easy to identify in this setting and patient population. This thought process is that every individual deserves to receive health care of the highest quality. It is easy for those suffering with substance abuse to have biases placed on them when seeking out treatment, and it is even easier for these individuals to avoid seeking treatment because of this. Nurses can assist in this injustice by promoting treatment options and supporting anyone who seeks assistance. The significance in relation to healthcare. Substance abuse plays a large role in the current healthcare initiative across the nation. According to Healthy People 2020, they have a goal of decreasing the proportion of adolescents using alcohol or illicit drugs, but does not focus on the adults already impacted. The overall goal of the healthcare community is to prevent, manage, and treat all healthcare-related illnesses and disorders. Substance abuse treatment centers, whether detox-focused or residential, are just a small outbranch aiming to reach that goal. This scholarly project will bring light to the importance of effective and inclusive policies in substance use treatment to ensure implementation and continuation of these effective group therapies and activities that take place within these treatment centers. The significance related to advanced practice nursing. Advanced practice nurses hold the power to prescribe medications to assist with symptoms of withdrawal. They can evaluate and refer therapy sessions that can be individual or group. And also they can identify the need for follow-up, continuation of treatment, or identification if the individual is ready for discharge. This scholarly project can be a part of the advanced practice nurse's rationale for collaborating with leadership members to ensure that the policies are effective and encouraging of patient success and recommending group therapies for individuals going through the detoxification program. Project support. So the site of this project is a 12-bed inpatient substance abuse detoxification center. It also houses a 26-bed inpatient substance abuse residential 28-day rehabilitation program. However, this project was focused specifically on the 12-bed inpatient substance abuse detox. The facility only tends to adult patients over the age of 18. Some offerings within this facility include licensed therapists, the group therapies, individual therapies, evaluation time with an advanced practice registered nurse or medical doctor, medication-assisted interventions, and alcohol or narcotic anonymous meetings. Some employees in this facility include therapists, APRNs, MDs, registered nurses, mental health specialists, and full-time security guards for patient and employee safety. So Chapter 2, Literature Review. The search history for this project included resources from Medline, the Cochrane Database of Systemic Reviews, and the Cumulative Index to Nursing and Allied Health Literature. Some of the keywords listed below. The search yielded in total of 18 relevant current publications to support the evidence to conduct this quality improvement project. During the literature synthesis, 4 themes were identified: availability, clinician improvement, motivation and dropouts, and routine and structure. So theme 1, availability and access to care to substance abuse recovery. Lack of availability can lead to lack of motivation for change. According to some of the research, dropout rates increase when individuals are separated by distance from their family and or support system. And then just thinking through some things, if there are not available treatment centers, how can someone who is suffering with substance use obtain treatment? Therefore, just putting into continuing the epidemic of substance use. Lack of availability in staff and clinicians also can lead to a decrease in available resources that can be provided within these treatment centers. Theme 2, clinician improvement of practice. There's a need for efficient clinician education, training, and support. Training and experience are required to effectively lead a group therapy. A study looking at 16 substance abuse clinicians from 4 different substance abuse treatment centers found that clinicians in this field of treatment are unaware that their clients are actually interested in opportunities such as group therapies throughout their programming. So when clinicians are interested and involved in providing therapy opportunities, whether group or individual, the clients tend to stay in treatment longer, associated by a feeling of support. And other research goes to support that the longer an individual is in treatment for substance abuse, the more likely they are to have sustained sobriety. Theme 3, motivation and dropouts related to substance abuse recovery. So motivation must be present. If an individual does not want to obtain sobriety, it is difficult for them to be successful. This population typically has low motivation, low sense of self, and some form of past trauma. Treatment planning should include altering the negative mindset to encourage success and improve behaviors. This is more along the lines of a CBT, cognitive behavioral therapy, like treatment. We need to improve self-destructive thoughts, which can also align with the CBT. And staff needs to be motivated as well. If staff is not putting the patients first and thinking about their progress, the individuals in the treatment are unlikely to be motivated themselves. Theme 4, routine and structure of treatment. Oftentimes, substance abuse treatment is rooted in routine and structure. They are able to encourage and impose skills for fundamental tasks of daily living. Commonly, individuals who suffer with substance abuse do not have routine or structure in their outside lives, so this can be an adjustment period for them. It can give them comfortability in knowing what to anticipate next while they're going through these large life changes. It can create a sense of purpose while they feel like they have no control. Safety purposes are self-explanatory in that aspect of things. Patient and employee safety is priority. And although substance treatment should have routine and structure, it's also understanding that it is not a one-plan-fits-all type of treatment. Some literature strengths. The studies in this review have met the IRB approval. None of the articles chosen stated any form of conflict of interest or possible conflict of interest. The studies included in this review, they used appropriate randomization to reduce the chance of bias. And there was also included meta-analysis and random control trials, which are considered the highest level in the hierarchy of research. Some literature weaknesses. There was homogeneity. So many of the studies focused on adult men from the same region or community, but this was mainly because it is more common for substance abuse to be seen in men. Other studies focus primarily on clinicians and staff members, where they do not present information focused on the client. And then cross-sectional designs as opposed to longitudinal studies, which is difficult to conduct and maintain efficient and sufficient research. Some literature gaps. One of the prominent gaps in literature was the focus on therapy sessions, but not specifying if they were group or individual. So for the purposes of this study, the articles that referred to therapy will be generalized to support the project, while keeping in mind that group therapy is not the only form of therapy that these individuals will receive during their programming. Another gap in literature is the involvement of electronic and digital forms of mental health care. And for the purpose of this project, the articles that focused on digital health will be used to provide supplemental information on substance abuse treatment, as well as identifying any downfalls of digital assessments. Some literature limitations. The main limitation that was found throughout multiple of the reviewed studies is lack of generalizability. Studies that are conducted within a defined region, the results may not be conveyed to other cultural groups. Other limitations due to the lack of generalizability can be related to financial status of those involved in the study. For example, in regions that have a low socioeconomic status is common. The use of substance abuse may also be common, but there may be a lack of availability of treatment related to the financial aspect or regionality of the facilities. The concepts and definitions used in this project include group therapy, substance abuse treatment, and addiction, with their definitions presented. The theoretical framework for this project was Lippett's model of change. It includes 7 steps. The first is developing a need for change, establishing a change relationship and assessing the motivation, clarifying the assessment for change and determining resources, establishing the goals and intentions, examining the alternatives, transforming the intentions in actual change, and generalizing and stabilizing the change to maintain. Chapter 3, Methods. The methodology. This study was conducted at a detoxification and residential treatment facility. It was utilizing the agreed-to instruments. The averages and ranges of each domain were identified from the agreed-to instrument, and results and recommendations were identified and presented. The design. Policy reviews in the form of agreed-to instruments will be provided and collected between November 4th to November 15th. Approximately 3 participants will be used for this study. Each individual used as a participant will be screened using the inclusion and exclusion criteria to identify if they are ineligible to be a participant in this study. The inclusion criteria includes the individual is 18 years of age or older, has worked on the detoxification program within the facility. The individual must understand the definition of a substance use disorder. The individual must be employed by the facility for longer than 1 year, and the individual must have a different job role compared to the other participants. The exclusion criteria is if the individual is under the age of 18, has not worked for the facility for at least 1 year, has the same job role as another individual selected as a participant, and if the individual has never worked directly on the detoxification unit. The steps for this project: IRB approval was obtained. Following that, the employees were placed through the inclusion and exclusion criteria. Each individual was identified as a participant, will be given identifiers. Their age and initials were utilized, as well as their role, just to keep the results on scale. Participants will be given the agreed-to instrument to complete along with the policy selected, and will be given education on the instrument. A time frame of 2 weeks was given to complete the agreed-to instrument. Data collection was then combined to identify areas in need of attention, and recommendations will be produced and presented. The sample included 3 participants who are employees within the facility, but who each have a different role. One was a registered nurse, one was a charge nurse, and one was a mental health specialist. The setting is a substance use treatment facility for adult patients 18 years or older who are diagnosed with substance use disorders, including alcohol use disorders. And the instrument was 3 separate agreed-to instruments. This is a table of the budget. Materials used were paper, pens, fuel for travel to the facility, wear and tear on car, electricity, printing of the report, and refreshments. A total cost estimated was $176.80. Protection of human subjects. Identification of the facility will be broad when presented. Identifiers will be used for each instrument to avoid identification of the employee. Identifiers will then be removed after data collection, and data will be kept on a secure laptop that is password protected. All data will be destroyed at the end of publication. And Chapter 4 findings. Methods of evaluation. So the IRB approval was obtained. Informal education was then given to each participant on the agreed-to instrument and the purpose of the project. No conflict of interests were identified. No patients were utilized, nor their information. And once the agreed-to instruments were collected, data was collated to identify ranges and scores for each domain. Only employees who have experience on the detoxification unit were included as participants. Each employee was provided a printed copy of the selected policy to ensure that the correct policy was referenced. And the agreed-to instruments is an established and widely used tool. Data was then transcribed independently by this presenter. Ethical considerations. No patient involvement. There was also no patient information utilized. Participants who were employees who understood the facility and its processes, the patient population, and any possible implications. Data analysis. On the first table is Table 2, the agreed-to Domain 1 results. Domain 1's focus is scope and purpose. As you can see in the table, the registered nurse. Registered nurse 2 was referred to as the charge nurse, and then the mental health specialist. On a scale of 0 to 7 were the scores, 0 being least likely to recommend and 7 being most likely to recommend. And then on Table 3 is Domain 2. Domain 2's focus is stakeholder involvement. You can see the scores represented there. Table 4 is Domain 3's focus of rigor of development. There was 8 subparts of this. As you can see, many of the scores were 1s, indicating that this policy had some areas for improvement or modifications. Table 5 indicates Domain 4's focus of clarity of presentation. And Table 6 is Domain 5's focus of applicability. Table 7 was Domain 6 focus of editorial independence. And finally, Table 8 is the agreed-to overall rating results. The recommendation for use was the most important piece for this project. 2 of the employees, the registered nurse and the charge nurse, indicated that this policy is not recommended for use in their opinion, and the mental health specialist recommended that this policy be used if modifications were taken. Just another way to view the results. So these are the domain mean scores. As you can see, regardless of the domain, nothing reached higher than a 3. And just a reminder that the scores can range from a 0 to a 7. Recommendations were then conducted and presented to the facility. Some of the recommendations included identify a required number of group therapy options, identify educational needs at this setting, identify requirements for group attendance, identify if retiming the groups around medication administration would be effective in increasing group attendance, and identify minimum attendance percentage to transition to the residential program, identify protocol consequences for non-attendance, identify encouragement and engagement resources to increase attendance. The outcomes recommendations were presented to the leadership members, which included a clinical manager, the director of the facility, and the lead clinical therapist. They were provided with a printed copy of the recommendations. Leadership members were receptive, however, no change initiative has been taken thus far. Some facilitators and barriers. There was no unexpected problems, failures, or costs, no modifications to the project, no missing data, and as new information and research was established, new areas of improvement were identified, such as areas for suicide assessments and improving the dietary nutritional options within the facility. Current policy is not set up to the standards of the employees or the agreed-to instrument. The lowest scores in the domains 5 and 6 were applicability and editorial independence. And then lastly, domain 7 indicated the policy is not recommended, but if it were to be continued for use, modifications would be indicated. There were no unintended consequences. Discussion of recommendations with the leadership team could have produced better outcomes. However, resistance to change is an ongoing challenge in the healthcare field. And Chapter 5 discussion. Some strengths of the evaluation. It highlighted the overall need for modifications. The employees are able to identify lack of detail and direction in the current policy, and various roles in the participants allowed for varying viewpoints. Some limitations included the possible participant-to-participant communication over the 2-week period while the agreed-to instruments were filed. And although a significant need for modifications was identified, leadership members of the facility were unwilling to create change at this time. Post-implementation insights. The IRB approval was time-consuming and challenging, resulting in a delay in data collection. Multiple re-education presentations were required for the participants to fully understand the agreed-to instrument. It was identified that the facilitators were important in the success of this project, and the participants appeared to be motivated and open-minded for change. Leadership of the facility opted for no changes at this time, indicating a need for further research to continue education. Temporary changes to the policy would be beneficial for a future study to assess and monitor patient outcomes with each change in long and short-term patient goals before permanently altering the policy. Plan for sustainability is to provide supportive information and research. Continued research is necessary for a lifelong mental health implication. This project will be shared with those in this field who are interested, as well as others who are not, to create and enhance awareness and educational opportunities. This project in its entirety will be shared with the stakeholders that are inclusive of Maryville University's instructors and students, the leadership members of the facility, as well as the employees of the facility who were participants in the study. It will also be shared with individuals who have expressed interest in this topic and who are enablers for change. The following slides are inclusive of all of the resources utilized for this project. Thank you for listening to my presentation.